This meeting is being recorded.
Right. Well, hello, everyone. Welcome to the Women Veterans Alliance webinar. And again, just real quick housekeeping, if you could just please remain on mute, utilize the chat box to share your branch and where you're coming from or watching us from. And also showing your video is not a requirement on this webinar. So I am Melissa Washington. I am the CEO and founder of Women Veterans Alliance. I am located here in Sacramento, California. If you're not familiar with our organization, we are a nationwide organization with our mission is to connect you, women veteran, with each other as well as resources. And one of the ways that we do that is through our Wednesday webinar series. So again, welcome everyone. If you're not connected with us, we are on all social media, Facebook, Twitter, Instagram, Pinterest, LinkedIn, as well as YouTube. And I always have to share, this is Diego, if you want to know, because he likes to make an appearance when I am on Zoom. If you're not a member of Women Veterans Alliance, we are having a membership promo. So if you are interested, feel free to send me an email and I can share that information with you regarding our promotion that we're having for anyone that's looking to become a member. If you have not heard, Women Veterans Magazine is our yearly publication. We have launched in California. Currently, we are working on Florida, Texas, the DMV area, and going to be expanding into additional states. This is a yearly publication that is available in digital as well as print. And we currently have an opening for advertising sales. So if you are interested or know of someone that might be interested in this position, the advertising salesperson will help us grow and get into other states. Please feel free to send me an email. And we have some more Wednesday webinars coming up. Next week, we have Beth Ball, she's from the USA Hockey Warriors program for disabled veterans. She's going to be sharing more about that. And then the following week, we've got most common disabilities among women veterans, followed by Facebook referrals in June, and then the art of confluential leadership in June. And just to let you know, so we do have more coming up in June and some more in July, and that will end our Wednesday webinar series. But don't worry if you've missed some, they are available on our YouTube channel, and highly recommend that you subscribe to our YouTube channel so you can watch not only this, but other webinars as well. So without further ado, I would like to introduce you to Yolanda Hagen. She is an Air Force veteran. She is the Women Veterans Program Manager for VA Northern California Healthcare System for the past 2.5 years. She entered the military as an E1 and retired as an 04. She has deployed to Iraq and has been to several humanitarian, such as Ecuador and TDYs, to include Misawa, Japan. She has over 16 years of nursing experience as a labor and delivery nurse, women's health nurse, and a manager. She has earned her master's in nursing with emphasis in education. She understands the needs of women veterans to include the need for cultural transformation within the VA. So without further ado, I would like to introduce you all to Yolanda Hagen.
Hi, everyone. Yes. Hi, everyone. Thank you so much for having me here. I am honored to be here and to present to you. Let me go ahead and get my slides ready. Give me just 1 second.
Yep. And again, feel free to use the chat if you have questions, and I'll be helping out Yolanda with the chat as well.
Okay. Are you able to see my screen?
Yes, we are. It's all yours.
Okay. All right. Wonderful. Yes, please go ahead and ask those questions. Let's start off by asking you a question. I really want this to be interactive, so please put your answers in the chat. And I'm not able to see them, but Melissa's going to really help me with that. So what year, first of all, I want to start off, I noticed that some women are from other areas. This training, this information, some of it is applicable to all healthcare systems, and some of it is very specific to us here in Northern California. I will let you know the difference between the two as I go through them. And then if I forget, just mention it in the chat and I'll be happy to let you know to answer that. All right, so what year were women officially allowed to serve in the military? Women have been serving go ahead and write it in the chat. Women have been serving in the military way before they were officially allowed. And they served as seamstresses, cooks, and nurses, and many other services. Any answers?
We've got one. Come on, ladies, don't be shy.
Yeah.
Right, we've got one,
What?
1941.
Good guess. A little bit earlier than that.
Got 1952, 1918. So Yolanda, you want to share
Ooh.
what year?
Yeah. Actually, it's 1917. 1918 is when the Marines were allowed women to serve as administrative assistants. So in 1917, what service other than the Marines hired their first woman? Enlisted or recruited? Any wild guesses? Any guesses?
We've got Army, we have the public health.
Okay. Actually, it was a naval reservist, female naval reservist. Her name was Loretta Walsh, and she was the very first one which allowed the rest of us to serve, right? And again, in 1918 is when the Marines were allowed women to serve. Then what happened with Navy? So this was during World War I, and recruitment was low. With men serving, and so they hired a woman, and their numbers went up. All right, so here's a little bit of information. Women, as I said earlier, have been serving in the military for way before the Civil War, excuse me. But I want to tell you that depending on what report you look at, currently about 15 to 18% of active duty service women are on armed forces are women. And our women veteran numbers are expected to grow. Currently here in Northern California, we have 11,173 women veterans who are enrolled. And starting in October, we're actually going to gain Stockton and then Sonora. And then by January, we're going to also get Modesto, California to join us here at Northern California. So our numbers are going to jump up to 13,000 women plus. And so the average age of the woman here is 48 years old, whereas for a man it's 63. And what that tells us is that there's definitely different services that we need to provide for every age group of women here. When you look at this graph, you can see that the highest number is 35 to 39. That means that there's a lot of women coming in who are going to have little children in tow, right? That they're either pregnant or can't get pregnant or have children. And so we have to address those concerns and how to care for them. And there's a lot of legislative laws that are coming into play, but we have to have the policies to make those changes. And those are coming down the pike, like childcare. So what year did Congress grant veteran status to women who had served in the Women's Army Auxiliary Corps during World War II? What year do you guys think that was? Don't be shy. Any guesses?
We don't have any guesses yet.
Okay, oops, let me move this over. Okay. All right, I'll let you know that it was actually in 1980. That is about 35 plus years after women had served in the military. And that's really sad. It's really taking the Congress and government to make these changes over time slowly for us. Yeah, but we're moving ahead. We're making a lot more changes and they're coming. All right, so here's a little bit of overview. I do want to just stress, I'm not going to go and read each and every area here, but it wasn't until 1980, so 1982, they did a pilot study that was published, and then 83, Veterans Healthcare amended the 1983 law. Basically, 1984, the advisory committee did identify that need, but it wasn't until 1985 when they had the first women's care coordinator, what they called it, over at the Women's Health Service. And it wasn't until later that we actually had women veterans program managers, my position at every healthcare system. So it's been very slow going, but like I said, we're making changes. So this is just a little bit of an overview where I get my directives from, where where in structure the Women Veterans Program falls, and it's under the Women's Health Service. All right, so how many women veterans do we currently serve in Northern California? And this is a trick question because I gave that information out not too long ago. You want to write in a wild guess? All right, good. Heidi, you got it right. Thank you for playing along. Yes, so we currently do have 11,173 women veterans receiving care in Northern California. But you know what? We have close to 30,000 women in our catchment area. A catchment area is the area that we serve. There's Palo Alto and San Francisco, and then they have their catchment area. So our catchment area is right now from Sacramento and Martinez, the Bay Area, all the way to Nevada. County or Nevada, and then all the way up north to the Oregon border. That's our area. Nothing over by the ocean. That falls under San Francisco. And so our 3 areas that we're really focusing in, there's a lot of areas, but one of them is productive health, postmenopausal, and geriatric. But we're also, with our strategic plan, we're looking at rural health. We're looking at homeless women veterans, and we're also looking at women paying special attention to women who are over 60 years old. Because, a lot of these women who are 60 years old plus really did not get the care that they deserved during the time when they transitioned out of military. They didn't even know that they were veterans. And so there's a lot of, I really want to provide these services and education to them to let them know that, hey, the VA has changed and we are providing services for you. So this picture here is really showing that there is growth. The blue is the growth in women veteran enrollment, whereas you can see in men, it has decreased over time. This is from fiscal year 21. So you can see, over the years, fiscal year 21, it was negative by 0.19%, whereas for us, it was positive by 1.05%. So we're going to continue to grow. And what they're saying is that the men or the male veteran number is going to stagnate or continue to decrease. All right, so there are a lot of reasons why women veterans are not identifying themselves as veterans. What we are doing is one of those cultural changes is asking if they served in the military, because then that's a segue to saying you are a veteran. So, about 25% of our women veterans do not identify as veterans. Many women feel like they didn't deploy, and so they're not a veteran. Some think that the VA is still very male-centric, meaning that it's very, it's their grandfather's VA, if you will, and that really has changed. When I first got off active duty and went to the VA for assistance, I did feel like it was, an old man's club, and I felt really uncomfortable in the way they were looking at me. I did not want to go back because I felt unwelcomed. And then I thought, let me try this again 15 years later, and it was better, but it wasn't where I wanted it to be. And so having this opportunity to work within the VA system, hoping to make that change for our women veterans to make them feel included and welcomed. And so some women, they say, well, the VA does care for us, but they don't provide gender-specific care. Well, we really do. The one campaign that I have here at Northern California is Don't Call Me Mr. campaign. And the reason for this is because I attend a lot of focus groups, and the theme across all of them is that women still continue to be called Mr. And so I really want to change that from the inside out. When I teach at the or train at the new employee orientation, this is what I share with them this screen, and that is that, if we call every veteran by their first name as veteran and their last name, we're never going to get it wrong. We're not going to, we're going to be very pronoun. We're going to eliminate that pronoun altogether and give them that veteran Smith or veteran by their last name, and then followed by how may I address you today to help. Okay, here's another question. So, does the Women Veterans Program oversee the Women's Health Clinic? Yes or no? All right, Heidi, thank you for playing along. So the answer is yes and no. I know it's a trick question, and I'll explain to you why. So it's really no. It's really no, but there is some yeses in there. So when we look at the Women Veterans Program, and any Women Veterans Program manager, this is their job right here. They are to lead the overall care of all women veterans, right? We work with the strategic plan. We really try to work with the cultural transformation. We train staff, we do outreach, we collaborate with other services, but we also provide oversight. And so we also enhance services at the facility level, and we do that. We also serve as advocates. So that is what the program itself does. However, the Women's Health Clinic itself is ran by and supervised primary care. And so that's what the difference is. And primarily here at Northern California, we have a little bit of division of labor, if you will, where we have the Women Veterans Program on the left-hand side and the Women's Health Program on the right-hand side. And there's some overlap sometimes, especially when we have, like, I am in charge of the Women's Health mini residencies where our nurses and providers take that specialized training to become women's health providers and work in a women's health clinic. And what's specialized about that, so we ask every woman coming into our VA system to be assigned to a women's health provider, because they attend this very specialized training where they are taught on how to provide trauma informed care. They're also made aware of what it's like to be deployed, about post deployment health, what happens during military service that other providers do not get. So I really want to push that, because it's really important that our women know that they are going to get that specialized training, specialized care that they really deserve. Back here on the left-hand side, just letting you know that under my purview, I do have like the incontinence and heart health coordinator, and she's running this new program and trying to get this up and going about creating incontinence education and providing a quick order step for the providers to make things easier for our women veterans. We also have a breast care nurse navigator. In her assistance, her focus is abnormal mammograms and women who have breast cancer. And we have one-on-one social work counseling that we do. And then our navigator walks the woman through identification of and through the process of chemo, of treatment, and post-recovery. And then we also have a MammoPap coordinator who takes care of the screenings, making sure that we work with the women's health champions that I'll talk about a little bit more later, and making sure that that you get those letters saying, hey, you're due for your mammogram or your pap, or you're overdue. If there's any other questions about MammoPap, you can always contact me or the MammoPap coordinator. We also have a lot of women's health social work programs that are going on. We have one actually starting, is called DBT. And it's an amazing program where you deal with your internal cues on how to deal with situations and how to better manage those situations. It's an awesome program that I wish I could attend. But I'm working, so I can't. So, and then we also have a women's health program support assistant who's helping us manage all of this as well. And we have the Deputy Women Veterans Program Manager that we were recently able to hire back in December. And then we have our partners. We have MST Recovery Coordinator, we have an LGBTQ plus coordinator, and we have an IPV, which is Intimate Partner Violence Coordinator. In addition to, if you need additional services with GYN and reproductive health, we do have a GYN service and a GYN nurse manager and maternity care coordinator, and we'll talk about maternity care in just a little bit. All right, so every what we call CBOC, which is a community-based outpatient clinic, has a women's health champion. Actually, 2 of them need one, but the rest of them do have them. And what they do is they are my extended arms. So if there's something going on at the local level, she's in communication with me, and we talk about what's going on, how to better care for women veterans. They assist with mammography tracking and cervical cancer screening. And so let me ask you this, question number 5. What is the #1 diagnosis of women veterans? What do you think it is? Crystal, thank you. Yeah, yes. Arthritis. These are all sort of related. Yeah, Heidi, you're actually correct. It is actually PTSD, chronic and unspecified. That is the #1 diagnosis here at Northern California. I believe at the healthcare service, I want to say that it's either PTSD is first or second, followed by depression, and then also by back pain. But I don't have those numbers in front of me. But wanting to tell you that, and we'll talk a little bit more about the mental health services that we have. The #3 diagnosis here in Northern California is back pain. And yes, if you served in the military, the equipment and the gear is not made for women, right? We have high intensity training. We have that heavy combat gear during training and deployments. We have high impact activities. All of that plays a role with our chronic pain, with our limited movement in muscles and joints, with our reduced blood flow, our strains and our sprains. But we do have services to assist with those, right? So on the right-hand side, you can look and see that we do have the primary care. That's where we ask every woman veteran to start with services, is with primary care. And then primary care will give referrals to pain management and physical therapy and orthopedics and acupuncture, occupational therapy, and rheumatology. And we also have some complementary therapies like Tai Chi and yoga that we'll talk about in just a little bit more too. All right, so this is not all comprehensive, but you can see that we have a lot of services for our women veterans. We have the one that I do want to touch on is 2 of them actually, is maternity care services and also PTSD mental health MST. Maternity care, so while the VA does not deliver babies, what we do is pay for the services for maternity care up to 7 days of life for the baby. So mom, everything's covered. Sometimes there's a copay depending on if your service connection percentage. I don't know all the ins and outs about how that's broken down, but I do know that they do provide newborn care for 7 days. That's going to be expanded to 14 days. I'm not sure when, but soon. Women veterans are given maternity belts and also maternity bras. And then if they choose to breastfeed, they get a breast pump, they get lanolin cream, and they get the pads, the breast pads that go with that. And the other thing that we do have is if a woman is hospitalized and they are pumping, we have a hospital grade pump, breastfeeding supplies and equipment that we have that I store here in my room, and it's readily available to them. And just really, really quick, we also have transgender care, and we're creating a transgender quick order set for our providers, which again will help our veterans. We have prosthetics, which means prosthetics is used here a little bit different than in civilian sector. It just means that we have supplies and equipment to help with the transition. And that's a big gamut of items. We have gender affirming hormone therapy, fertility preservation, voice and communication training, and we also have an LGBTQ plus coordinator, Elizabeth Rocha, that we work really closely with. An incontinence program, really important. We do have pelvic floor physical therapy. We do have education. And again, we're creating that quick order set for our providers to help our veterans on how to guide them as to step 1, step 2 of how to take care of that incontinence concern. When it comes to MST recovery, we have Dr. Novotny, Catherine Novotny. She's our MST recovery. We're hoping to hire another position of peer support specialist with MST recovery. We do have PTSD Webster program. It's a self-help web-based program. We also have, with counseling and treatment for substance abuse, depression, suicidal ideation, mental health, an acute mental health unit here at Mather. And we have a plethora of other social work services, which actually I'm covering right now. On the right-hand side, you can see what the programs that we currently have. We have emotional support therapy, we have holistic care, we have acceptance and commitment therapy, virtual women veteran support services. We also have one-on-one VA disability claim assistance. Specializing with MST, we can walk you through and connect you with the right service provider or VSO who can help you process that claim. We also have Social Security application. And then we also have on the left-hand side, our integrative medicine, complementary health, Tai Chi, which is right now virtual. Chico has yoga, and I'm not sure if it's virtual or not. We used to have Healing Touch and Reiki. We're trying to get those started again as COVID is sort of on the downtrend. However, the numbers are starting to creep up just a little bit right now. So that may be on hold. We do have acupuncture here at Mather and Mare Island. We have a recreational therapy, stress reduction, whole health, mindfulness. We have a lot of services. Moving on, we do have a lot of applications too. And so there's two things that I'm going to speak to you more specifically about, and that is that we have a VA health chat. I love this feature because it gives me three, and I've used all three. If you need to speak to an urgent care provider and you can't wait to speak to your provider, or if you have My Healthy Vet and you're not able to get through, you message your provider and they still haven't gotten you through, VA Health Chat is the way to go. So you can get urgent care provider, you can make an appointment, and you can speak with a pharmacist. And I've done all three. Just to speak to urgent care, it was Friday at 1 o'clock. When can you get care, hold of your provider? I was able to get I was able to speak with a nurse practitioner who then called me, and she was able to order medications for me. I was able to pick up my medications at 4 p.m., when clinics usually close at 4:30 and pharmacy maybe 5, 6, I don't remember their times. But I was able to get my medication before the beginning of the weekend. And so really appreciative of that. It's my go-to. I educate every person that I can come in contact with about this chat because it's really phenomenal. Another way to get a hold of us is through My Healthy Vet. You'll need to have a premium account, but we are listed when you sign up, and if you have an account, we will be listed under NCHCS_WMS. Basically stands for Northern California Healthcare System Women's. And this is more specifically, this My Healthy Vet account is for Northern California, whereas My Health Chat, it should be throughout across the US. All right. And then we do provide outreach. We've been doing a lot of outreach these past couple of weeks. We do have a retreat planned for women veterans in June. We just had a Drive and Thrive baby shower, Drive and Thrive resource for a baby shower in March. We also have quarterly focus groups, and our next one is May 26th at 12 o'clock. This one's going to be specifically focused for women who are younger than 40 years old, who are pregnant or have delivered in the last 1 or 2 years. And then the next one in July is Rural Women Veterans Perspective on Whole Health Programs. And so we have different ages, different focus every time. And so if you're interested in joining some of those focus groups, we want to hear from you. If we can make our service is better for you, then that's what we want to do. So reach out to me. I'll have my information at the end, and you can always, like I said, reach out to me. We're also having a Women Veterans Town Hall. The next one scheduled for June 28th from 12 to 1:30. And our focus is going to be MST, recovery coordination, and where breast care and cancer care mammography is going to be our highlighted items, but you can call in for anything during that tele town hall. And then we also have a Her Voice newsletter. Our first one was really, we had a lot of issues delivering, but we're working on our second one, and we're hoping that it's going to go out by the end of June. And then we always present and educate to VA and community partners like today. And then we have some consultation services. This is more of our advocacy. We do have the Women Veterans Call Center. You can call that number and it's going to come to us, and we're going to speak with you to troubleshoot what the issue or concern is and to make it better. We also conduct environment of care rounds, and that's really important because we want to make sure that privacy and dignity is addressed. And we also have the patient experience. If you have an issue or concern and it's something that's related to direct patient care or whatnot, then we can troubleshoot that, and we can try to make sure that our services are better. One of the hindrances recently has been that they're not allowing children into the VA. That has changed. So if you ever come across a CBOC or a clinic that you're going to and you're being told that you can't come in because of your children, I want to hear about it, because that's not okay, because they do allow children. And so we advocate for across the healthcare system. And so, that includes having lactation rooms available. We are purchasing more lactation pods for our CBOC so that our women employees and veterans have access to them. So we're doing a lot of things here at Northern California to make sure that you have your needs met. Here's my contact information. What we're doing is my information is at the bottom. The top information is we do have a women veterans email group, and we have also a telephone group number, and then you can always reach us through My Healthy Vet, Northern California Healthcare System, NCHCS_WMS. So that is it. Is there a lot of questions or any questions?
There are some in the chat.
Okay, I stopped sharing, so this should be easier to look at the chat. Here we go. Okay.
There's a question about community care referrals.
Standalone certified massage therapist having to drive. Yeah. So Dawn, that's a really great question about community care referrals for standalone. Yeah, that is. Why don't you call me? I know you and I have talked, but let's take this one off chat so we can give more information. Community care has been overhauled, and they have hired, I want to say, 20 nurses and like 30 support staff to assist with the process, because we recognize that there's issues with community care. And so one of the setbacks with community care is that we have such a great need and we don't have enough providers out in the community that meets that need. So it's something that I know our healthcare system is evaluating, that the need exceeds the availability, but we're definitely working on that. Oh, my phone number, a good number to reach me at is 916-843-7417, Janine. Jeannie. All right, any others?
And also too,
Yes,
I will add Yolanda's contact info when we send out the link to this as well.
There you go. Thank you so much. Yeah. I hope that this information was helpful to you. And like I said, if you ever have any questions, feel free to reach out to me. I also have Deputy Women Veterans Program Manager Chelsea Miller, and between the two of us, we are just, taking our program to the next level to provide those services. Yes, reservists. So Olivia, because you served, in order to get VA services, you need to have performed active duty for a minimum of 2 years. And because you were active for 4.5 years, you're automatically eligible for VA services. Some of the questions that I get sometimes is a reservist. I had a reservist who served 22 years, was never active. All she was never active, was never deployed. And unfortunately, with the current laws, she wasn't eligible because she never had any active duty time under her belt. She didn't have a DD Form 214 that spoke to that. Now, there may be other issues that I wasn't aware of, or other rules and regulations that I'm, because I'm not VBA. That's more of a business administration, and the healthcare system is completely separate from that. So I would advise that if you ever have any questions about veteran benefits, that you go through a VSO who can answer those questions. I can try to guide you in the right direction, but I mean, I don't want to give you a wrong answer. Let me see. Okay, Jeannie, sounds good. We see up above, there is a question on Gulf War illness. Gulf War illness. All right, so great question. Where is it at? I can give you general information here. Okay. So right now, President Biden called, or has signed into law 10 presumptive conditions that you can get service connection for. Meaning, presumptive meaning that you don't have to, if you were deployed to the Middle East, I don't know what the years are, that if you were deployed to the Middle East, that you have any one of those 10 conditions, that you will automatically get a service connection. Now, I don't know how much of that service connection you're going to get. I think it may be dependent on the severity of the symptoms. And so, and I don't have that list in front of me. I believe if you go to va.gov, it may have that information. You may be able to Google it as well. And so, so the question specific is, Sarah asked, otherwise known as chronic. Okay. So are we receiving information or training about chronic multi-system illness? You know, I'm not familiar with chronic multi-system. I am familiar in that during the Gulf War back in 1990s, that years later they did do some studies and found it, and there is some presumptive service connection through the Gulf War. What I would say is we do have, it's called the burn pit registry. It's not specifically for burn pit, but if you were deployed to these areas, to the Gulf War, to the Middle East, that if you go into this, they're going to ask you a lot of questions, very detailed. And it's not connected to service connectivity, but what's happening is they want to gather this information, because the more women reveal their illnesses that have occurred while military service, they're going to connect the dot, right? Because if one woman has it, well, it's random. If 20 women had it and they were all deployed at the same time, then that's an issue. And so, but they're not going to know unless you're registered. And so I'll be honest with you, I started the registration process, but I didn't finish it. I really need to go back and finish it, because I want them to capture my data so that I can help other women veterans and see if whatever issues or illnesses I have are also correlated to that. And so in that, what that happened, so that will drive service connection in the future, you know, to get some more of those presumptive service connections, or connections that are presumptive. Okay, let me see here. So we do have a VSO right here at Mather, at our Mather clinic. Okay, any other information, questions? The MST, no, Heidi. Our MST coordinator, Dr. Novotny, is housed out of Martinez. She does have a group, and she does have information. You know what? Let me pull it up for her. Give me a minute, and I will give you her. I will give you her phone number. can reach out to her. Okay. So her name is Dr. Novotny. And that is her number. All right, any other questions? You're welcome. All right, Melissa.
All right, Yolanda, thank you so much. We greatly appreciate it. And again, appreciate your
welcome.
time and all the very resourceful information.
Yeah,
And
thank you. Thank you so
Thank you
much.
so much.
All right, bye-bye.
Bye.